The next tab we're going to talk about is going to be the Objective tab. Here you will find your assessment. To add an assessment, click Add. It will automatically populate a time, and usually that time is your on-scene time. What you need to do from there is click Now, and that will put the actual time you're doing the assessment. Performed by, who did it? Was an ALS assessment performed? If there is a paramedic on the ambulance, the answer to this question is yes. Stroke or CVA symptoms. Did this patient have any stroke or CVA symptoms today? Yes, no. You saw them in your presence or they were gone prior to arrival. All right, airway. Is it patent, partially obstructed, or completely obstructed? You have the button down here, WNL, within normal limits, and you can click that, and it'll select patent. Breathing, same thing. Select WNL, normal respiration. Circulation. This one you cannot do within normal limits for some reason, and there's a lot of stuff on circulation. First you have capillary refill, less than 3 seconds. Then you have hemorrhage, none. Then back to circulation, carotid, normal, brachial, and femoral, and lastly radial. Now you go to the patient's mental status, oriented person, time, place, and event, ANO times 4, or if they're not, select the proper one for it. If it is somebody that has like a developmental delay or something like that, you can select normal baseline for the patient. Neurologic, if there's no neurologic deficits, you can click WNL. Any blood or fluid loss, if none, you can click WNL. External skin, cool, hot, dry, sweaty would be on here. Now we're going to go through the body survey, and we're going to move through this kind of quick because almost everything on here is duplicated for everyone. This is not something where you need to fill everyone out. Let's just say, for example, the patient has a left ear laceration. Then you would only do left ear and go down and click laceration. But as you can see, as we go through these next slides, there's going to be quite a few. This one is head, face, left ear, right ear, nose, left eye, right eye, mouth, both eyes, neck, trachea, chest and lungs. This would be for your breath sounds, clear bilaterally, decreased in the lowers, what have you. Heart, for heart tones. Abdomen, upper left, lower left, right lower, right upper, and general abdomen, the periumbilical region, and the epigastric region. Pelvis, genitalia, upper right arm, right shoulder, right elbow, right forearm, right wrist, right palm, and then all your fingers, upper left arm, shoulder, elbow, forearm, wrist, palm, all your upper right leg, right hip, right knee, lower right leg, right knee, right ankle all the way down through your toes, upper left leg, left hip and knee, lower left leg, left knee and ankle, left ankle and your toes, the back of your head. This is going to be for the back of the body, and I'm just going to kind of go through these kind of quickly. Of course, we'll stop right here for cervical. If you see anything, you know, if there's if the C-spine's not in line, make a note of it here. More back. All right, now we move to the impressions. Your primary impression um, is what you see when you see your patient. It does not have to match the chief complaint because, as we all know, in EMS, a lot of times the reason they call 911 isn't really the reason they call 911. So you put your primary impression and a secondary impression. Primary impression for this example is abdominal pain, just general abdominal pain. Second to acid reflux. Protocols. This is for advanced skills for when EMTs administer nitro or oral glucose. Pretty much any time you're giving a med or doing a procedure, it needs to be documented here. And you'll see what the categories are and then what the protocols are. And if this is trauma related, you will need to fill this out. If it's not trauma related, you can ignore this. Other, intensive injury, patient condition, kind of goes back to the other one. Row location, position, height of fall, those will be highlighted if possible injury is yes, like row location for on a bus, airplane, position in the car, height of fall if they fell. ETOH and drug use, if they admit to it or if they don't, we cannot speculate. And then the final one is cardiac arrest. This one you will not have to do unless your patient goes into or is found in cardiac arrest. And that will be it for the objective tab, and next we're going to be on to vital signs.